What is trauma-informed care and why does it matter? Hi, I'm Dr. Rebecca Berens, founder of Vida Family Medicine. When people hear the term trauma-informed care, they sometimes think it's not something that can be done in a traditional medical practice, or they think that it only applies in therapy or mental health settings. But trauma shows up in every part of healthcare, from how we take a history to how we conduct an exam to how we discuss and explain results and come up with a plan. And so it's really important that we are thinking about this for anyone in the healthcare profession. And I practice and am passionate about trauma-informed care because I believe it can and should be standard. And so today I'm going to share what that means and why it matters for both patients and the clinicians that care for them. So first off, what do we mean when we say trauma? I think trauma is kind of becoming a little bit of a buzzword now, and it's losing some of its meaning. So I want to talk a little bit about what trauma actually is. So first of all, trauma is not just the big obvious events that happen to people, like big accidents or violence or wars, those sort of big events in people's lives. Trauma can also be chronic and sort of smaller events over time that build. So that can be chronic stress from food or housing insecurity, or other forms of chronic stress. It can be racism or other forms of discrimination. It can be medical trauma from chronic illness or a major medical condition. It can be weight stigma, or it can be any other experience where a person's control or dignity was taken away. And so for many patients, just walking into a doctor's office by itself before anything else happens can bring back those feelings of being dismissed or ignored or shamed. There's inherently some power dynamics at play between a doctor and a patient based on the way that our system has been built and the history of how medicine developed, that further amplifies those feelings. And so trauma-informed care starts with understanding that anyone we meet could have that history. It's not obvious from looking at a person if they are going to experience trauma in the medical setting, or if they have in the past experienced trauma in a medical setting. And so whether we know it or not, anyone could have this history, and it's important for us to keep that in mind.